Okay, so we've got a patient that's come in here with some cracking and callousing down the lateral aspect of their foot. Now, this one can get a little bit tender because we've done this before if we take too much off. So usually what we do with this one is just remove that surface layer and try and remove as much of those cracks in the foot as possible without causing any pain, because obviously they've come in to try and fix the pain. We don't want to cause any more pain. So we go down here and just basically shave all this off, and it comes off really quite easily because this patient's got quite a moist foot, so it's not overly dry. You'd imagine if it was a lot drier, it would crack a lot worse down the outside of the foot here. So basically what we're doing is using a number 10 blade. We won't show the whole video. We just show you removing some of this callousing down the outside of the foot. It makes the patient feel a lot more comfortable, and it just, particularly during winter in Australia, the air gets really quite dry. So we go ahead and remove these. We usually do this in winter time just to help to limit the chance of these cracking, and it also causes this sort of feeling like there's a second skin over that foot because the callus builds up so thickly. So we remove that. We know not to take too much off because it can become painful, and then we'll see the patient again in about sort of 4 to 6 weeks and do this, or if there's any cracks open up, we'll actually do this earlier, but usually 4 to 6 weeks in the winter, and then she doesn't come in for about 12 weeks over the summertime when the air's got a little bit more moisture in it and the skin doesn't dry out as much. So they can be, the reason we do this is because it can be a portal for infection, particularly if you're a diabetic. We want to make sure that we actually remove all of those cracks out of the foot so there's no chance that they're going to crack up and split. And then we encourage the patient to use some emollient or moisturizer. We usually use 10 to 15% urea cream to try and soften the skin and get them back in 4 weeks' time.